there is a huge misunderstanding of what homeopathy really is. There's a huge amount of misdirection that's used by people who are completely ignorant about what it is, which generally results in a discussion about the fact that it can't possibly work from a scientific basis because there's nothing in it. But unfortunately, the people who purport to foster this particular idea generally haven't studied the subject and generally haven't practiced it. So the ideas that they have are something that they picked up from a book somewhere but has no relation to the actual science or practice or the art of homeopathy. When you begin to study homeopathy, the first thing you learn is that the concept of dilution and the dilutions that we use in homeopathy are a supplement to the actual principles of homeopathy. The principles of homeopathy are actually nothing to do with the dilution. Therefore, the dilution is to make it more palatable for the actual patient. The basic principles of homeopathy are that like will cure like. So in other words, it fosters the way that the body is going to get better on its own way. If you have symptoms as a patient, those symptoms are part of the process of which your body and your mind is dealing with the issue that you're struggling with. So the first thing you have to ask yourself is how justifiable is it to just come along and remove those symptoms or suppress them? Because this is the basis of conventional medicine. And on the surface, it seems quite logical that if you have pain or you have symptoms that are unpleasant, that you would want to stop those actually being manifest. But if you stop for a moment and consider that those symptoms are part of the way that the body is actually healing you, then you have a completely different perspective on the whole concept of symptoms and the desire to remove them from the face of the earth. Homeopathy was actually developed, and it hasn't changed in its development over the last two and a half centuries. It was developed at a time where the suppression of symptoms by even more dangerous drugs and blood leaching was the main thoroughfare used by doctors and apothecaries. And the original chap who discovered it, Samuel Hahnemann, actually came across it from out of desperation, because he was in a similar situation that we frequently find ourselves in today, that we stand back and say, well, some of the things that we're using are not appropriate to give to people or are causing more harm than good. Iatrogenic disease nowadays, which is the side effects from medicine, is actually one of the major problems that we have to face. You frequently find patients, and I had them when I was in conventional pharmacy, who were taking multiple drugs to cope with the side effects of the previous drugs that they were having. I had one woman who was on about 12 different medicines, each one countering the ill effects of the first medicine. And this is taken as the norm. Now, when Hahnemann actually started homeopathy, when he began, he was not even practicing medicine, because he was so disenchanted with the way it was practiced. He'd given up and he was translating books. And he came across one book which was written by a well-respected Scottish physician called William Cullen. And in translating the books from English or German, or he had 14 languages at his disposal, he encountered one paragraph in one monograph which was describing the actions of a particular drug made by the South American Indians to counter malaria. And this was the bark of a tree called Cinchona officinalis. And what they used to do is they used to strip the bark off this tree, boil it up, and drink this very bitter brew. So it was a completely material dose. And this information, that this would cure malaria, and it was the only thing that they had, was passed back to the old world from the new world by the Jesuit priests in the 1700s. And it had found its way into this book that William Cullen had written. It was a herbal and it was a monograph within this Materia Medica. Hahnemann was asked to translate this book, and in around about 1790 he's reading this book, translating it, and he comes across this paragraph which says, because there was no concept of pharmacology in those days, that this bitter substance cures malaria and marsh fever in those days was prevalent around Europe because the swamps hadn't been drained, because it's extremely bitter and it has a tonic action on the stomach. In those days, the concept of pharmacology was limited to those things that excited the body and those things that calmed it down. So the tonic action on the stomach, the astringent action of this really bitter brew called China on the stomach, was deemed to be the reason why it cured malaria. Now, Hahnemann was a reasonable bloke. He was sensible, very intelligent, and he said, well, he said, this is a lot of rubbish. He said, there's no way that this stuff cures malaria just because it's bitter. He said, it must be doing something else. And it bugged him. And he kind of went around with this for a while, and he said, I've got to find out what this stuff does. So he procured what he says was 4 drams of good China, this bark, and he boiled it up, and he made a bitter brew, and he decided to try it on himself. So over a 4-day period, he imbibed this bitter brew, and he made very careful notes. This was essentially the beginning of what he termed provings, which in German proving is a trial. And he was essentially initiating the earliest drug trials. And in this case on himself, because he didn't have anybody else he could reliably give them to. So he, over 4 days, took this bitter liquid, and he started getting really nasty headaches, he started getting aches in his joints, he started getting an intermittent fever, which he was assiduous in recording, even though this was in a date before the invention of the thermometer. So he was getting night sweats, he was getting fevers, he was getting aches in the joints and throbbing headaches. He said, I've got all the symptoms of malaria. I've got the symptoms of the thing this stuff is supposed to cure. How the hell did that happen? And from this, he realized that there was an almost Newtonian concept of like equals like going on in the body, that action and reaction are equal and opposite, that the same thing that was actually possibly going to be able to cure you if you had the symptoms would actually be capable of generating those very same symptoms if you were healthy. And this to him was a revelation. And he became almost religiously fervent about this revelation, which is essentially the essence of homeopathy, that the similimum principle that we're looking for is the match. Now this match, and he obviously had to explore whether this was just a phenomenon with China, or whether it was actually more of a general principle. So he gathered around himself men that were strong, many students, and they conducted many provings on lots of different toxic substances, which were known to have therapeutic effects, to establish whether this generic principle that like equals like was actually going to be reproducible. And it turned out that it was. In the course of this, he was obviously coming across the most toxic substances known to man, and he couldn't just give them in a material dose, although that would have worked, but it would also have killed the person at the same time. So he began to dilute these doses. Further down the line, he realized that the actual dilution principle was in itself of a benefit to the process. But one shouldn't escape the essential principle of homeopathy, that it's about material dose, that the material dose is, well, it's actually more about the similimum, the actual matching of the symptom picture that the person is having with a symptom picture that can be generated quite precisely and written down of a particular plant, mineral, chemical, whatever, which can be referenced and then matched against the other person, the person. That's a fundamental misunderstanding of homeopathy. The fact that people think it's about a drop in the ocean and therefore the drop in the ocean can't work completely omits this fundamental principle that that's not what it's about. It's not about how dilute the substance is. It's about how matching it is and how significant it is for that patient at a given time and place. So this is a not inconsiderable issue that we have to face in homeopathy, because the lack of education means that people are looking at homeopathy as some sort of esoteric alternative that doesn't have any basis in science. And the fact that it does is mystifying, because today's science is very much a closed box. It's become so for various different reasons, but it's very difficult for people who are learning more and more about less and less to expand their horizons, to comprehend this very strange philosophy that the body does work in this way. And yet it's been known in homeopathy for over 2.5 centuries. Homeopathy, interestingly, hasn't changed in 2.5 centuries, whereas conventional medicine has gone through millions of revolutions in that particular time. It's always the latest thing that comes out. And it's because of this that we're in a bit of a dilemma in terms of our NHS system, for example, where the concept in 1948, and interestingly, homeopathy was embraced in the original healthcare system because it was very popular medicine within the UK, and has been for many years. It was therefore embraced within the UK, along with the 5 homeopathic hospitals, which also teach doctors and vets and pharmacists and other medical professions how to use homeopathy, how to practice it. In 1948 it started. But at that time, the fundamental flaw of the system was moving away from the panel system, where it was really a question of those who could afford medicine and those who couldn't. Suddenly everybody was able to have free medicine. And it was quite well known that people would say, am I really going to get a free pair of spectacles? And not believing that they would, they immediately went to get 2. So the kind of the rape of the NHS has been going on since 1948. It's based on the fact that it's a free medicine on the one hand, and the fact is that it's always purporting to give the best free medicine, which is excellent, but the best keeps changing and getting more and more expensive, to the extent where not only we can't we afford the medicines and the therapies, now we can't afford to employ the people to actually use them. And so we're in a dilemma at the moment where, obviously we want to have the best healthcare, but because homeopathy is being looked at as inexplicable from the point of view of modern science, there's now discussion of actually removing it altogether from the healthcare system. The reality of that is that the budget for homeopathy in the UK is something of the order of £4 million, which is a tiny fraction of a tiny fraction of the budget that it's actually spent on the NHS. In removing that £4 million and saying, well, we shouldn't have homeopathy in the NHS because it's not evidence-based medicine, we can't prove how it works, we're in danger of losing sight of the fact that the people who are actually benefiting from that £4 million will probably cost £8 million to treat, because they will be going on to drugs that have to be repeated over and over again, whereas the homeopathic treatment is usually curative rather than palliative. And this obvious concept doesn't seem to have hit the horizon of the people who are looking into the situation and examining it.